if you look at the landscape of cardiovascular disease, I think over the last several decades we have done an enormous amount in terms of stemming the risk of cardiovascular disease and its complications. Despite that, cardiovascular disease remains the #1 killer of both men and women in the United States. So we have not eradicated the problem. We're doing a good job, but the problem still exists. In my opinion, there are several factors as to why we have not gotten to where we want to go. So smoking is obviously a very important issue, and while we've done a really great job with nicotine, e-cigarette use is a major issue. I think the perils of marijuana, I think, will become more known over time. I think that smoking and secondhand smoke and even air pollution contributes to cardiovascular risk, and I think that that's something that we will need to address. Probably even more important, in my opinion, is the epidemic of obesity and the fact that the types of foods we are eating are really filled with simple sugars or refined sugars. I think that because we are in an era where fast food is so available and so inexpensive, I think unfortunately it targets a lot of the lower socioeconomic status populations, which makes them at even higher risk for having heart disease. So I think this is a very big deal that I think needs to be concentrated on, both as, researchers, clinicians, but I think it's much bigger. I think it has to be tackled from a population standpoint, and I really hope that we do a better job with that. And then finally, I think physical inactivity is a very big deal. So in today's era, with cars and buses and trains, people are not walking as much as they should. I think, people who sit at a desk, and unfortunately I am a culprit, I sit at my desk a lot, but what I do is every hour or two I get up, I walk to the stairwell, and I walk up 5 flights, and then I take the elevator down. Because I know that when you are more physically active, when you use your muscles, your body gets in much better shape, much better health, and it's not only good for your heart, but it's also good for your mind. And there are a lot of data that it associates with lower incidence, lower prevalence of dementia. So I'm a very big fan of reminding patients, actually everyone, the importance of healthy lifestyle. I think that if we can improve our lifestyle, I truly believe we will have a healthier population.